So let's make a start. Okay, so welcome to the GP training update. We're going to talk about the new GP contract and GP trainee money matters. Okay, so here we go. Just for those of you that haven't met me before, very brief introduction. So my name is Dr. Mahibur Rahman. I'm a portfolio GP based here in Birmingham and Solihull. I'm a consultant in medical education. So as part of my clinical work, I work as a resident GP in a secure unit for women with severe mental health illness, so they're sectioned, most of them. I work in community detox, and then I partner in a private GP practice, and sometimes I do some locums in NHS practices. I'm also a GMC examiner and invigilator for the PLAB exam. I'm an author for the prescribing safety assessment, and really my expertise over the last 15 years has been helping people pass exams to develop professionally, especially GP exams. So GP entry, MSRA, stage 3, MRCGP, AKT, CSA, but I've also trained GP trainers. And we've coming up to close to about 37,000 delegates we've trained at eMedica in the last 15 years. So that's where I'm coming from, teaching. So what we're going to do today, we've got 1 hour, and I'm going to split it into sort of 2 sections, and then there'll be Q&A. So the first 20 minutes, we're going to focus on the new GP contract, which you might have read articles or heard about. Specifically the changes to GP training for those about to start, for those in training, and those applying soon, the new fellowships after training, and then frequently asked questions that I've received lots of messages about, because hopefully then we can answer really the common ones, but there will be a chance to ask other questions later. And then the second half, we're going to focus on GP trainee money matters. So for example, ways that you can increase your take-home pay, but without working any extra sessions, without having to do locums. Why? GP training is full on. And, it's one thing to do the odd locum here and there, but I have seen that doctors that are doing lots and lots of locums, often it starts impacting their preparation for membership exams or how they get on with their workplace-based assessment. So I'm not talking about that. I'm talking about how to increase your take-home pay without actually working more, so that you can maintain your well-being. And again, frequently asked questions about those things. And then the last 15 minutes, live questions and answers. Okay. What we won't cover today is about GP entry and how to get into GP training. That's because there's not enough time to cover that as well. That's a whole subject in itself. We have a whole nother webinar. We have full day courses covering things like that. Okay. Today is about the new GP contract and GP trainee money matters. Now, a few basics to the software we're using. So you'll see this chat function. Okay. Please use that for discussion. Okay. If you've got a question you'd like me to answer in the Q&A sections after each section and at the end, please put those in the Q&A, because questions in the chat won't be answered. They won't be picked up because there's a lot of doctors in this. It's difficult to follow the chat, okay? But the Q&A comes to me in the order they were asked. And then there will be a point where I might launch a poll, an interactive poll, and you click the poll function to say, which option you'd like, okay? So you'll see that later on when I'm going to ask you about something, okay? We will be recording this, and I will send out the recording of the slides probably tomorrow when it's been processed. Okay, so let's make a start. The first section, 20 minutes or so, we're going to focus on the new GP contract starting 2020. So we'll look at the basics, we'll look at the changes to GP training, we'll look at the fellowships, and then changes for qualified GPs. Looking at the questions that you answered before you even started, I can see we've got a mixture of doctors who are starting training soon, some who haven't even applied yet, most are in training, but some ST1, 2, 3, and then quite a few actually who are already qualified and post-CCT, and again, probably read about this new contract and want to know more about it, okay? So contract basics. First thing is the new contract only applies to England for now, okay? And it only applies from April 2020. So some of the details still haven't been finalized because what we've got is a draft agreement at the moment. Scotland, Northern Ireland, Wales, none of what I'm going to talk to you about the new GP contract applies to you. However, it may well be that some of these changes get followed. That has happened in the past where, the contract changes in England, and then we see similar things happening in the other home nations, okay? So the basics are there's going to be increased funding over the next sort of 4 or 5 years coming into general practice, and that's so that we can get more doctors in GP, and a big chunk of those extra doctors are going to be more GP trainees, more GP registrars. There's also going to be funding for more allied health professionals. So when you're in training and when you're newly qualified, you might see that, for example, there are more clinical pharmacists working in GP practices. You might see more nurse practitioners, paramedics. And so that's also going to be, part of your team that you need to be working with. The structure of GP training is going to be changing in the future. And you might have heard about these 2-year fellowships. And there's going to be funding to encourage more GP partners. So I'm going to talk about each of these in a bit more detail. So if we start with changes to GP training, the first thing is that there's going to be a lot more spaces for doctors to get into GP training. So from 2021, there will be at least 4,000 just in England. And then when we add the places in Scotland, Northern Ireland, Wales, there'll be more than 4,500 places to start GP training each year. That compares to about 3,500 just a couple of years ago. So it's a big increase. And then from 2022, the structure of GP training will change. So at the moment, most GP trainees will do somewhere between 18 and 20 months in hospital, depending on whether they have 6-month rotations or 4-month rotations, and somewhere between 16 and 18 months in general practice. What's going to happen for 2022 is that you'll have just 1 year in hospital, and then you'll have 2 years in general practice. Now, I want you to have a think about that, and just type into the chat, what do you think some of the pros, first of all, so the advantages of shortening the time in hospital to just 1 year and having 2 years in general practice for new GP trainees. Just type in the chat what you think some of the good things are about that. Okay, I'll give you some time to do that. Okay, so some answers starting to come in. So someone said, you avoid rotations that might not be that useful for general practice, like trauma and orthopedics they specifically mentioned. Someone said that be more confident in GP surgery to practice independently after you finish, more exposure to GP, which is more relevant. Most of the time, the specialty often has nothing to do with GP world. A lot more service provision, people have said. Often they're not, the secondary care posts aren't GP focused or GP relevant, someone said. Less on calls, someone said. No nights and weekends. So thinking about, your sort of antisocial hours. Okay. Okay, great. So I think a lot of things that people are thinking about are some of the things that I thought about. So let me show you the ones that I thought of. So some of the pros, the benefits of shortening time in hospital. You get more GP exposure. If you're going to train to be a GP, it makes sense that you spend the bulk of your training time in the specialty you're going to do. It wouldn't make sense if you want to be an orthopedic surgeon that you spend half of your time doing breast surgery and not doing orthopedic surgery, or you spend half of your time doing medicine, okay, and not doing anything surgical at all. So more GP exposure. Several people said something along this line, but less rota fodder surface work, i.e. less time just filling a gap in the rota, and you feel like, look, I'm just doing work here, I'm not getting that much training relevant to what I want to do. Less antisocial hours. So while you will do some out of hours work as part of the GP registrar contract when you're in GP placements, you generally won't be doing a series of nights. You might do maybe 1 or 2 night out of hour sessions. You will have to do some evenings, you'll have to do some weekends, but you're generally not going to do lots of nights, lots of weekends. It's a lot less than in hospital jobs. And a few people have said that there might be more time for MRCGP exams, in terms of that when you're exposed to GP, your exams are purely GP, they're not hospital. That it might be more relevant things, so you might have more time in an environment where you actually, especially for CSA, the more exposure to GP consultations, the more likely you're going to be prepared for CSA. Now, someone said that they don't think it's a good idea, and that's what we're going to talk about next. So now type in the chat window, what do you think are the cons, the downsides of shortening the time in hospital? Okay. What do you think the downsides are, the negatives now? So what are the cons of having only 1 year in hospital and 2 years in GP? Anyone think of any negatives? Please type that in the chat. Okay, so some answers have started coming. So some people say nothing. But a lot of people are saying you get lack of exposure to acute specialties. You less understanding of how the specialist services work, not knowing where to refer and what happens at the other end, less experience in relevant hospital specialties, no experience with some of the emergency stuff, okay? The hospital rotation often makes you more confident when you are in GP in knowing how to manage things yourself. Okay, dealing with acutely unwell patients that are going to need to be admitted, less exposure to certain clinical conditions and specialties, or patients that are more unwell, less exposure to relevant specialties, things like peds, derm, gynae. Someone's said something that a lot of people don't think about: less pay. Yeah. Lack of dealing and learning some of the physical procedures like steroid injections, okay, which can be really, I do joint injections in general practice, but where did I learn that? I learned that when I worked in rheumatology in my GP training, and when I did orthopedics before I did GP training. So things like that. Okay, great. So again, most people have got most of the cons. So yes, in some cases you will be on lower pay. Why? Because if you're in a rotation which is got lots of nights and weekends, yes, the downside is it's antisocial. The upside is that often it will bump up your total pay to a lot more than when you're in GP. Okay, if you're doing A&E or peds and you've got lots of nights and weekends, it can make a few £100s or several £100s a month take-home pay difference. Okay, less exposure to relevant specialties. All right, for example, in the new system, if you have 6-month jobs, you might only do 2 hospital specialties. Let's say you do A&E and you do medicine. That means that you might not have done any peds. Now, already sometimes people don't get peds, okay? But, you're going to see a lot of kids in GP. When you're in GP, you will see probably 1 in 4, 1 in 5 patients that will be children. If you don't get dermatology, about 10 to 15% of GP workload has got a dermatology or skin condition attached to it, okay? If you don't have psychiatry, mental health is so common, not just people that present with a primary mental health condition, but often someone with chronic disease, with rheumatoid, might have low mood, okay? So that can definitely be something to think about, that it might make you less confident both when you are a GP registrar, but also when you're qualified as a GP. Now, there are ways that we can counteract that, okay? And I'm going to talk to you about that in a second. So how can you get exposure to some of these things? Well, the first thing is, well, when you are in GP, part of the GP contract is you get 1 session, so 1 half day every week, paid for self-directed learning time. That's not time off, it's time to learn. And you can use that, for example, let's say you didn't have any derm, to try to go and arrange with a friendly consultant dermatologist that can you sit in their clinic for 1 afternoon a week for 3, 4, 5 weeks, okay, and get some exposure, all right? You could use your study leave to go on courses or relevant conferences. You could do e-learning. You could potentially, let's say you had no women's health, you might do the DRCOG, the Diploma of, the College of Obstetrics and Gynecology, which is a GP-specific diploma, but focusing on women's health, okay? So you might do some of these things to get that exposure and get some of that knowledge and confidence. And something else that you might do, which I'll tell you a bit more about later, is you might attend our National GP Trainee Conference, which was specifically designed, because even now, a lot of doctors with 18 months in hospital and 6-month rotations, they might have 3 jobs: A&E, medicine, and then public health or something, and they might not get exposure to derm, to ENT. And I'll find out a little bit more about what you have and haven't got exposure to later, but we specifically designed this to counteract some of that. So for example, this year we'll have a GP with special interest doing a session on women's health, but specifically for GP-focused women's health. Because if you've done a hospital obstetrics job, people earlier were saying a lot of service. A lot of time what you're doing there is assisting in C-sections, a lot of ward work, bloods, things like that. Not necessarily things that are going to be that useful when you're a GP. We've got a consultant dermatologist covering the top 10 skin conditions that we see in primary care, when to refer, how to identify them. We've got a GP with special interest in ENT, doing ENT for GPs, top conditions, top skills. He'll demonstrate how to do an EPLI, for example, to treat BPPV in the GP setting. Then I'm going to do workshops on MRCGP, AKT, CSA, and GP career choices, and there'll be some keynotes. I'll talk to you more about it later, but I want to carry on focusing on this, that there are other ways to get exposure even now. And even when it shortens the time in hospital, there are some downsides, okay? So next I want to talk about fellowships, okay? So you might have heard about these 2-year post-CCT fellowships. There's lots of positives about these things, okay? So you'll have 1 session per week, paid CPD, and you'll have funded mentorship and a mentor to be attached to in that area. Now, some fellowships are already available. And for those of you that are already in training, if you're going to get your CCT in 2021 or later, so those who are finishing this August, and I know there's some of you that are in ST3 with us this evening, there are some fellowships already available, but they're sort of pockets. You have to really go looking for them. Those of you finishing next year, so if you're in ST2 or ST1, by the time you finish, everyone will be eligible to join one of these fellowships if they want to. Okay. From 2021 onwards, anyone starting training will automatically be enrolled into the fellowship. So they'll have 3 years training and then 2 years post-CCT fellowships. One of the big advantages of this is it allows you to stay in 1 year for 5 years. And okay, I can think about buying a house, or my kids are going to go to school. You can plan because you're not going to have to move immediately after finishing training because there might not be anything there for you. Okay. For international medical graduates, one of the things that can sometimes happen in the past is that if they came into training and maybe they'd done 6 months or a year before they started training, they'd finished training, they'd still have a year before they could get indefinite leave to remain. And sometimes if they couldn't find a practice nearby that would sponsor their visa, they would have to move to a completely different part of the country to find a job. And that can be difficult, uprooting your family and things like that. So one of the things that they'll be offered a 5-year visa at the time that you start. So that's to cover the 3 years of training and the 2 years of fellowship. So you know where you're going to be in one place for 5 years, one area. And then at the end of that, you're eligible for indefinite leave to remain. And after that, you can get citizenship, right? It makes life a lot easier, okay? So those are starting to come in from new entrants for 2021. But for those of you in training, if you're in ST2 or ST1, you'll be eligible to, join these fellowships, okay? There are a lot of them coming about. Something else, new GP partner support. So that's from this April onwards, okay, i.e. 2 months' time, all right? If you are a full-time GP partner, you take on a new position as a GP partner. So a GP partner is someone who owns the business, okay? You take on the risk of running the business. You're not just doing your clinical work. You've got your clinical work. But you also need to manage your staff. You need to manage the business. So there's a lot more paperwork, admin, and there's a lot more responsibility and time, okay? That you might have read about this 20K payment. So first thing is, I looked at the small print in the contract, and it's not actually a payment. It will be given as an interest-free loan, but after minimum time as a partner in that place, the debt will be wiped. And they haven't specified, but it says in the document, e.g. 5 years. They haven't finalized this. As I mentioned, at the moment, it's a draft contract. But if it says e.g. 5 years, that's an example. It might be slightly longer, it might be slightly shorter. So it's actually not just a payment. It's actually an interest-free loan. And then if you stay in that job for 5 years, you won't have to pay it back. But if you leave, you're going to have to pay it back. And if you're not full-time, let's say you're working half-time, you'll be eligible for half the payment, but again, as a loan. And then if you stay there for 5 years, you don't have to pay it back, okay? And there'll also be a £3,000 business training allowance, because another thing that often doctors would say is that they finish training, they've learned the clinical stuff, they've passed their membership exams, AKT and CSA, and then now they look at partnership, but they don't the beginnings of running a business because they've never run a business, okay? And often, going on a course to learn some of this stuff, first of all, it's difficult to find some of these courses, but sometimes it can be quite expensive, and it's another expense that might put a barrier to someone wanting to become a partner. And what Health Education England and the Department of Health are saying is that we don't want that barrier, so that you can get, essentially, this isn't just money to have, this is money to spend on CPD relevant to you becoming a partner, okay? That's actually starting, so even if you're an ST3 and you're finishing this August, you'd be eligible for this, but just understand it's not free money. It's actually a loan and you have to pay back if you don't stay in that. So don't look at it as a golden handshake. Look at it as golden handcuffs. You've got to stay in that one place. So when you consider after tax, because you'll be a higher rate taxpayer as a partner, okay, you're only actually going to see about £10,000 of this. Over 5 years, that's £2,000 a year. Just be conscious that don't make this a reason to become a partner if being a partner isn't the right thing for you. And actually, one of the things that I'll be talking about in my workshop on GP career choices is how to weigh up salaried versus partner versus locum versus portfolio GP. What are the pros and cons of each, and how to compare the money, for example. Okay, and then something else, the locum support scheme. So primary care networks will group together to engage GP locums. And if a GP locum says, look, for this area, this group of primary care networks, I'll do at least this many sessions per week. They haven't said how many, but let's say I'll do at least 4 sessions a week. 4 half days, 2 days a week between the different practices, then they will pay you to have one funded CPD session a month. Because currently as a locum, if you want to go on a course, not only will you get no pay for that day, you also got to pay for the course, right? Whereas as a salaried GP, you should get some paid CPD time. Okay. And then finally, the GP returner. So GP returner scheme, the induction and refresh scheme, is for someone who's qualified as a GP, but then left GP work and not worked for at least 2 years. Okay, so that might be they've gone abroad or they've not worked at all. They've taken time out. But if you do that for more than 2 years, you have to sit exams before you can start working as a GP again. The exams are the induction and refresh exams. So there's an MCQ, a clinical paper, an SJT, and then there's an OSCE. Okay, simulated surgery. Well, you do get paid during that scheme. You get funded to cover the cost of the exams for one attempt each time. But one of the things they're adding is up to £2,000 towards childcare. Okay, so that's something again to encourage people that maybe have taken a break to come back to general practice. So these are some of the ways that they're hoping to get more doctors back in. So let me just answer some of the really common questions, and then I'll take questions. Remember, if you've got a question, please type it in the Q&A. Questions in the chat won't be addressed. Okay, so first question, I've had loads of people contact me in the GP training support group, which, by the way, if you're not a member, do join, is will GP training be 5 years? The answer is no. GP training is still 3 years, and it will still be 3 years in the new contract. The 2-year fellowship is post-CCT. You're a qualified GP. You'll be paid as a salaried GP if you take one of these up. You're not going to be paid on a training pay scale. Do you see? So GP training will still be 3 years, okay? And then the 2 years is after you're qualified GP. It's a post-CCT fellowship. Next question is, will the new contract apply all over the UK? No, England only, okay? It may go elsewhere later, but not now. Next question, a lot of people ask, if I'm currently in training, will I have to extend my training because it will suddenly become 5 years? First of all, it's not becoming 5 years, but even if it did, they couldn't suddenly get you to extend. Why? Because you signed a contract as to what your training was. Your training is still going to be 3 years, okay? Even if they eventually move to 4-year training, which might happen in a few years, 5-year training I don't think is ever going to happen. Not in our lifetimes anyway. But if you're in training, you've signed a contract and they will honor that, okay? However, some of the benefits of the new contract, like the new fellowships, you'll be eligible to opt into. Next question, I've heard a lot of people ask, are the 2-year fellowships mandatory? Like if someone wanted to do 3 years, get their CCT, and they didn't want to do this fellowship and they wanted to locum, could they? Absolutely. It's not mandatory at all, okay? It's optional. If it was mandatory, then they would say that everyone will have to do it. What they've said is they hope to get 100% uptake or as close to 100%. They're hoping people will like the idea of you finish training, get some additional work where you're paid as a salaried GP, but with the support of mentorship, with paid CPD in the same area, so that you're not just competent as a GP, you start becoming confident as a GP, okay? Next question, is there a £20,000 bonus for new partners? No. There is a £20,000 interest-free loan that after 5 years you won't have to pay back, okay? But you will have paid tax on it, all right? So it's really about £10,000. And that ties you in. So don't look at it that way. I'd look at it more as a golden handcuffs rather than a handshake. And then a lot of people ask is, how can I get exposure to specialties missing in my training? So I mentioned I'd talk to you a little bit more about our conference, and then I'm going to answer these questions before we move on to the second half, which is about money matters. So, I mentioned you could go on courses, you could use your self-directed learning time. But one of the things that we had a lot of doctors ask us over the previous years is, look, I didn't get any peds. I wanted peds, but I didn't get any. I didn't get any women's health. I didn't get any dermatology. So I just want to actually see what's happening with that. Let me just see if I can just launch a poll. Just 1 second. I'm just going to turn the poll on. Okay. So I'm just going to put the poll on now. You should see a poll tab come up. And I'm going to launch the poll. I'd like you to answer this question, okay? You'll see the poll come up in a few seconds. If you don't see it because you're on a phone, just put it in the chat window. Which of these specialties do you not have in your training, those of you that are in training, or that you don't feel confident in, as confident as you'd like to be, given that we see a lot of it in general practice? Just, tap that. I'm just going to give you 30 seconds or so for that to pop up on your screen. Those that don't see it, you should see the slide. Just type it into the chat. And I'm just going to give you 30 seconds a minute. I want to see what people think. Okay, let's have a look in the chat, what people are saying. Yeah, those of you earlier that said you didn't see the poll, I've only just activated, so you wouldn't have seen it before. Okay, so 30 more seconds, and then I'm going to stop the poll. About half of you have completed your response. Okay, great. So just looking at what's come in so far, let me share some results with you. So about 1 in 5 people have said they either don't have dermatology or don't feel confident in dermatology. Okay, as I mentioned earlier, probably 10-15% of GP workload is to do with skin conditions. Okay, 15-16% no ophthalmology or not confident in it. 11% palliative care. We're all going to have to deal with patients getting older and patients, dying of different conditions. 10% women's health, 10% peds. Imagine that. Women are more than half the population. We see 1 in 4, 1 in 5, depending on which clinic I'm doing, patients is going to be a child. Okay, these are things that I think should be mandatory in training. But there's lots of things we'd like that aren't there. So it just goes to show, a lot of these things, a lot of people aren't getting exposure to. Okay, so I'll stop it there now. That's probably enough. So a lot of things that people don't get exposure to. So that's really where the idea of this conference came up. Okay, that we thought, well, what if we made it easy for people, because people can't always get someone that will host them at a clinic to sit with an ENT doctor, and even if they do, if they can do 1 or 2 clinics, they might not get exposure to a lot of the important conditions. So what if we've got someone with that expertise to come and teach you? So that's what we're doing. So the next one is this weekend in London. Okay, those of you that stay to the end, if you want to come, I will give you a code that's time limited that will give you a 50% discount. But we will have Dr. Nigar Arif. She's a GP with specialist interest in women's health, doing women's health specifically for GPs. Okay, some of this will help you for your exams, AKT, CSA, but more importantly, to be confident, to take good histories, to know what are the things to ask for, how to manage it, how to explain some of these things as a GP. We've got Dr. Avad Mughal coming from all the way from Swansea. He's a consultant dermatologist, but he also is a lecturer, and in fact runs a training scheme there. And he's going to talk about the 10 most common and important skin conditions for GPs to deal with. Dr. Ian Sweetenham is a GP with specialist interest in ENT and a GP partner. 30-odd years experience. Okay, he's going to be doing key ENT conditions, how to do key examinations, and also treatment in how to do the Epley maneuver. And then I'll be doing workshops for those of you in training on MRCGP AKT, how to pass first time, MRCGP CSA, how to pass that, and then GP careers. So portfolio GP, GP partner, salaried GP, locum GP, pros and cons, how to find what's right for you. So there'll be 6 workshops. You pick 4 of them, 2 in the morning, 2 in the afternoon. And then there's 3 keynote lectures, which everyone will attend. So Dr. Sweetenham will be talking about the good, the bad, and the ugly of being a GP with specialist interest, and his experience of 20 years of doing that. Dr. Arif, who also works as a media GP for the BBC, as a private GP, as an NHS GP, and for the CCG, will be talking about her portfolio career, how she combines all of that with being a GP with specialist interest in women's health. And then I'll be talking about how to succeed as a GP, both in training and beyond. So that's this weekend in London, okay, full day course. And last year we had consultant psychiatrist do a session on psychiatry for GPs. Dr. Mughal was there, who's doing his derm session. Dr. Arif was there, she's come back. I did the AKT CSA, and we had Mr. Imran Khan do ophthalmology for GPs. And, we're hoping to have some of these speakers come back again next year. So, we had you all go to the keynotes, and then you go to which workshops you want. So it's tailored to what's necessary and important for you. Okay, so these are some of the things that will be there. And I'll tell you the discount code at the end. So I'm going to go through questions now before we move to the second half, which will be talking about GP Money Matter. So as I mentioned, if you've got a question, please make sure it's in the Q&A, not in the chat. Okay, so I'm just going to go through and answer them. Again, if questions are about getting into GP, or things not to do with what we're talking about today, they're not going to be answered today, just because that's not the focus of today. Feel free to contact me privately or send an email. I'll be happy to help with any of those things. But today we focused on this. Okay, so let's have a look at the first question. So someone's asked, what if it's a great question. What if someone's less than full time? And might they see some of these new changes as part of their contract? If before they finish GP training, they come in. So as I mentioned earlier, you will sign a contract, and your contract will be honoured. So if you signed up, for example, you're going to do, you get a contract and you're going to do 18 months of hospital, 18 months of GP, and now they introduce some of these things, they're not suddenly going to say to you, look, you're not going to have that hospital rotation. You're going to do that. That's unlikely to happen. What you will see is, though, some of the things that, like the fellowships being more widely available, that will be available to you. So someone's asked, will a certificate given fellowship and will it give us FRCGP? No. Okay. These fellowships is called the fellowship program. That's completely different to fellowship of the Royal College of GPs. Okay. So FRCGP is a sort of, it's like a recognition of achievement in general practice. You can't be awarded that until you've been qualified as a GP post CCT for at least 5 years. And then either you can nominate yourself or someone has to nominate you who's already a fellow. Okay, and then you have to go through a sort of approval process where it will be looked at locally and then nationally by the Council of the Royal College of GP to see what contribution have you had to general practice. You know, are you worthy of being given fellowship? And I'm honoured that last year I was given a fellowship of the Royal College for my work in medical education and humanitarian medicine, and in promoting GP careers over the last 15 odd years. Okay, and it was great to meet lots of other, you know, doctors. Are honoured to be in that company of people very experienced, a lot more experienced than me, that have achieved wonderful things. But that's not what this fellowship program is. That's a completely different thing. Okay, it's a good question. Right, so next question is, someone's asked, what is the salary for fellowships? That's an excellent question. The answer is we have no idea. Why? Because there is no pay scale once you qualify as a GP. There's no fixed pay scale like there is in training. It's whatever the practice wants to offer, and it's whatever you can negotiate. And so it's probable that if they're going to roll out a national fellowship scheme, that they might have a salary band, okay, but they haven't announced anything like that at the moment. Okay, so we can't say about things like that yet. Okay, so someone asked another really good question: can the fellowships be used for covering specialties we didn't come across during training? So the fellowships themselves, most of your time will be doing clinical work in a GP setting, but you might have some time within that, for example, to learn about things like how to manage a practice and get more confident with the business side of things. It won't be to use that clinical time to get exposure to specialties. But remember that you will get one session a week, so 1.5 day every week, paid CPD time. You could use some of that time, I could envisage, to go and sit in a clinic, okay? Because you're being paid anyway, do you see, all right, through the fellowship program. So you could use that time, because you're studying, to go and sit in clinic, or to maybe not take it some weeks, build it up, to then, you know, go for a 2 or 3 day conference in a specialty that you haven't covered to get updated. Okay, so you could use things like that. Okay. Next question someone asked is, what are the benefits and differences between fellowship and working as a salaried GP? Well, we talked about the benefits earlier. You'll get paid CPD time, you know, mentorship. You know you're going to be in one area. If you wanted to just look for a salary job somewhere else, you could do. Okay, and you could negotiate what contract, but you might not get a one half day every week paid CPD time. You might not get any mentorship. You might just be expected to do the work. So the fellowship, if you like, it offers a transition. It offers a gentler entry into the world of being a qualified GP. Okay. Someone's asked, during fellowship, will the work be under NHS or private GP surgery? So during fellowship, you'll be working in an NHS practice, but each NHS practice is actually a private business. Okay. But you'll be considered, for example, you'll be eligible for the NHS pension scheme because it's considered NHS work. Someone asked, will you get any additional qualifications or certification from the fellowship program? No. Okay. Someone else asked the same thing about salary. Someone's asked, will this apply in Wales? We touched on that earlier. It won't. It's England only at the moment. And fellowships will be in the same area that you did your training. Okay. The fellowship will be fully based in GP, wholly in GP, no hospital at all. Okay, we've already answered. So I'm just looking through the questions here, excuse the pause. Some questions that people have asked, we've already covered earlier, so I'm not going to answer them to save time. You can always watch back the videos or go over the slides when you come out tomorrow, okay? Because we've already talked about them, okay? Someone says, how many years will the fellowship be? Fellowships are 2 years in this new program, okay? Someone's asked, can you do locums during this fellowship other than doing your GP surgery job? If you're working full-time, you could do locums if you wanted, but I wouldn't recommend it because full-time general practice is full-on, okay? And someone's asked, what if I'm just starting training now? will I get a 5-year visa? So at the moment, it says that it could start in 2020. It's intended that it will definitely start from 2021. But at the moment, the contracts coming out are still saying 3 years for people that are starting in August. It might change for people that start February 2021 onwards, okay? Someone's asked, what qualification will you have? You'll get no qualification at the end of the fellowship. You'll already be qualified GP though. You'll have your CCT at the end of GP training, okay? And someone's asked a really good question. Is that to develop a specialist interest, for example? Well, you might be able to use some of your CPD time to develop a specialist interest. You're going to need to get exposure to another specialty and higher qualifications. It's one of the things we cover at the careers workshop at the National Trainee Conference, but also that we cover in our CCT Plus course, which talks about all the career options in a lot of detail. That will be running in the summer, okay? There won't be any examinations at the end of the fellowship. It's not a certificate. It's not a qualification, okay? As to what you do in the fellowship, a lot of that will be, the main focus will be just working as a GP, okay? But with some mentorship and some support. What you use your CPD time to do is up to you. You've got to be proactive. If you want to get exposure to something else, you're going to have to find a consultant. You're going to have to find a course. You're going to have to do these things yourself, okay? Okay, so I'm just having a look. So someone's finishing training and they want to locum with the practice. Okay, so that's not to do with a new contract. So we do cover things like that at the CCT Plus course. Feel free to contact me separately or come to that. Okay. Okay, someone's asked a good question. The GP returner induction exams. What if someone's post CCT and they take extended maternity leave? Would that count? If you're not in clinical practice for 2 years or more, yes, you'll have to go through the returner induction exam for any reason. That's whether it's extended maternity. If you did maternity for a year, 18 months and came back, not a problem. But 2 years or more, not working in general practice in the UK, you'll have to go through the induction and refresher scheme and do the exams, okay? Okay, great, I'm just having a quick look. So someone's asked, is the GP training live available as a webinar? No, because we're going to have 3 workshops running at the same time. To live stream 3 of those, we'd need a whole production team. And the cost of that to us and to pass on to you would make it not worthwhile for anyone to attend. Okay, good. So someone's asked, what if someone not trained in England, like they're trained in Scotland, could they opt into a fellowship? Well, once they're available here, I can't see a reason why you couldn't apply for that in open competition if they're going to have jobs available. Like at the moment, there are some fellowships that are available in open competition. Anyone can apply for them that's got CCT. So I can't see why that wouldn't be the case for these. What is going to happen is that people that are in training in England will be guaranteed a place if they want it. That's the key difference, okay? Someone's asked, if I want to develop a special interest in dermatology, do I need to inform my deanery at the start of training? No, because your deanery is not going to do anything to help you with that in training. You develop special interest after. There are some things that you could start doing yourself though, which, contact me separately, or we do have courses covering things like that, okay? Okay, so I think, so someone asked, what does the mentoring involve? The mentoring will be a local GP, an experienced GP, usually someone, with 10 plus years of experience that might, guide you about some of the things about running a business, becoming a partner, or just getting used to. There's a big step up from being a trainee to being a qualified GP, okay? Someone's asked, will trainees in Scotland get a 5-year visa? No, because you're not going to be part of this scheme. It's in England, okay? Okay, great. And someone asked, is it different from academic clinical fellowship? Yes, academic clinical fellowship already exists. It's a 4-year training program where part of the time is spent in research or in medical education, okay? And someone's asked, can you buy videos of the workshop from the conference if you can't attend? Yes, videos will be available a couple of weeks later. Okay, thanks very much. Now, I'm going to close off that section now because I can see we're already running behind. If you've still got questions that haven't been answered, a lot of questions that are things that I've already answered, so I'm going to come back to them later. So I'm going to move on to the second half now for the next 20 minutes or so, because we've spent quite a lot of time on questions there. And that's really trainee money matters, okay? I'm going to give you some tips to increase take-home pay. Now, this was actually the keynote lecture, one of the keynote lectures that I gave last year at GP Training Live 2019, which we ran in Birmingham. Last year's national conference was in Birmingham. Okay, but it was really popular. And just because some doctors that came last year found it so helpful, they're coming back again this year in London. I didn't want to do exactly the same talk, but I felt that this was one of the sessions that had really, really positive feedback. People enjoyed the most. We had great feedback from all of them, but a lot of people found this helpful. So I want to talk about these things. How can you increase the amount of money you have to actually spend, your take-home pay, but without doing any extra locums or any extra shifts or any extra work? Because when you do that, yes, you have more money, but it comes at the expense of your well-being and spending time with your family and preparing for your exams. And I have seen some doctors get into trouble in that because they were focusing on doing lots of locums, to meet all of their expenses or to get income in, that unfortunately they failed their exams, or they, sort of got burnt out. They added to stress. Full-time GP training is really, really tough. It's really challenging. It's full on. You've got so much to do with your e-portfolio. The exams are really hard. Lots of people fail the exams, okay? The AKT has become noticeably harder the last 2 years, all right? And so, you really want to focus on these things. What you don't want to do something extra that gets in the way of you successfully completing training. So all of the things I'm going to talk about involve no extra shifts, no extra time away from your family, no doing any extra work. It does involve some time maybe doing some paperwork to claim somebody's money. So I'm going to talk about these things, okay? Let's start with claiming all your tax allowances. A lot of GP trainees either don't know what they can claim or don't know how to claim, and so they don't claim. Okay, so you can claim tax allowances for all of these things. Your GMC fee that you pay each year, you can claim tax relief. So that doesn't mean that it's free to you, but for example, if you're an ST1 or ST2, you're probably a lower rate taxpayer. What it means is you're essentially getting 20% of the cost back because they will reduce your tax bill the following year. Okay, if you're an ST3, you're probably a higher rate taxpayer. That means you're getting 40% back. Okay, so your GMC fees, if you're a BMA member, you can claim that. Your RCGP Associate in Training membership, or if you're qualified, your RCGP membership fees, your indemnity costs, if they're not reimbursed by the deanery. If they're already reimbursed, you can't also claim tax back because you've not paid for it. But those of us that are qualified, we're paying our own indemnity, right? I claim it back every year. Your MRCGP exam fees, you cannot claim for courses, although you may well be able to claim for courses from your study budget as a trainee, but you can't claim for courses when you're in training as a tax allowance, okay? You cannot claim for buying new equipment that you've not owned before. For example, let's say you want to buy a blood pressure cuff and a doctor's bag. I recommend you do that when you're qualified. Why? When you're qualified, if you're locuming, you can claim that. If you're an employee, you can only claim replacement for something you already have that's broken. So let's say now you've probably all got a stethoscope, and now your Littmann's finally broken, the tubing's worn out after 10 years of using it. You could buy a replacement. But if you want to buy a blood pressure cuff and you don't already have one, you can't claim that against tax. Okay, so all of these things, make sure you claim it. It can be several £100 that extra money in your bank account to spend, and it's really simple. So if you're claiming small amounts, less than £2,500 worth of expenses, you can just fill in a form called Form P87, and I'll send you links to all of this stuff when I send out an email tomorrow. Okay, or you can just Google P87, or if you're just claiming one or two things, your GMC and your RCGP, just write or phone the HMRC and say, I'd like to claim this. Give them your national insurance number, and you can do it over the phone. It's really straightforward. If you're claiming more than £2,500 worth of expenses that you want tax back on, you either need to fill in a self-assessment tax return or open a personal tax account. It's a new thing that came out a couple of years ago that makes it much easier to see how much tax you're owed back or how much you need to pay and manage your taxes. So claim all your tax allowances. That's the first way. You see, it will take you a little bit of time, but you've already earned this money. You're not going and doing extra shifts. You're just getting some money back for things that you just have to claim. Simple. The next thing is to claim expenses. So when you're in training, when you do home visits, that's considered business mileage. So you can claim the business mileage for home visits. If you're going on a study day, and the study day needs you to travel somewhere, you can claim the mileage to go to that other place because it's not your usual place of work. Excess mileage. So wherever you start your first job, that's your base hospital. All right. Or if you start your first job in GP, that's your base practice. So let's say from your house to your hospital is 10 miles. You can't claim that. That's your regular journey. You can't claim that. But let's say your next job is in a different hospital that's 5 miles further away. You can claim that difference, the 5 miles. You can't claim all of it. Let's say it's 15 miles from your house. You can't claim the 15 miles. While you were going to travel to hospital A in the first place, which is your normal commute, all you can claim is the excess mileage, i.e. further than your first hospital. If your second hospital is closer than your first hospital, you can't claim anything, all right? Relocation. If you're moving from one area to another to start training, you can claim the cost of the removal van. You can claim costs, in some cases, if you're selling a house and buying a new one in the other area, you can claim even things like stamp duty. That could be £4,000 or £5,000, okay? What you need to do, if you want to find out what you can claim, is check the local policy, because each deanery has their own policy as to what they will allow, when they will allow it, what the forms are, how long you have to make a claim. Sometimes they'll say if you don't make a claim within 1 month of actually doing that mileage, you've lost the right to claim it. So it's just being organized, okay? I won't take any questions of can I claim this or that. The answer to that is contact your employer, ask for the local policy. Only they can give you the answer because it's different everywhere, okay? Next thing is to get more benefit out of things you're already paying for. So as an RCGP associate in training, you're paying for associate membership of the Royal College. You can access the GP self-test question bank for MRCGP AKT. It's included, so use it. Okay, it's got some good questions. You're also, as you're considered a student when you are a trainee in GP training. You might think this is odd. Why am I telling this? Well, it makes you eligible for a totem card. A totem card used to be called an NUS, or National Union of Students card. Those who are a bit older like me might remember that, okay? That, you used to be able to get access to when you were in medical school. This gives you student discounts. Even though you're a qualified doctor, but you're in training, you're considered a student. Why? Because the Royal College is registered as an educational institution. And so you could get discounts of, everyday things you're buying, clothes, not necessarily to do with work, just your clothes, things that you're buying for your kids, okay? Meals out, that you can get student discount on, okay? If you're a member of the BMA, sometimes when people are preparing for membership, they might be getting certain books, like for CSA, a lot of people get books, the case books. These are expensive books, they're big booklets. You can borrow these from the library, from the BMA for free. You just have to request it. They'll post it to you for free. All you have to pay for is postage when you send it back. That's it. So instead of buying 4 or 5 books and spending £150, £200, you might spend £5 posting back for those 4 or 5 books, and that's it. If you're already paying for membership, you see, might as well make use of it. Now, that could be something related to your exam, but it might be, let's say now you're doing a musculoskeletal rotation and you just want to get a book to do with that, but you don't really want to buy that because long-term you might not need it. You want it to help you for that rotation. Borrow it from the BMA. And then MPS, all of you have to have indemnity. If you have got indemnity with the MPS, they offer some fantastic courses. Like when I go to courses, because I teach so often, I'm not often impressed, but I was really impressed by the standard and quality of the presenters, the consultants, and the GPs that they get to do the teaching. And I was really impressed. So they have courses on like dealing with challenging consultations. Patient gets angry, dealing with complaints, how to make good medical legally safe entries into the records, prescribing safely, communication skills, things like this, that you can get access to thousands of pounds of courses for free. You can also get discounts. MPS members, because MPS work with us, with the medical, you can get discounts on all of our courses as MPS members. And then you can get cashback. There's a couple of ways you can get cashback. So you can get cashback from HMRC. Those of you that, if you and your partner are working and you earn less than £100,000, which as a trainee you will be, and if you're eligible for access to public funds, then you can get access to something called tax-free childcare, up to £2,000 per child towards childcare. Now, a lot of us, childcare is really, really expensive. If you've got young kids, and you're working, that can be a huge expense. So how that happens is you open up a tax-free childcare account, and if you put £800, the government adds £200. So you've got £1,000 that you can then use to pay any registered like childminder or childcare, or even sometimes if your child's school has an after-school club or a homework club that's charged, that's considered childcare. As long as they're registered, you could use it towards things like that. Okay, cashback sites. Okay, this is a really simple thing, and that can, get you back a couple of £100 of extra money. So the two big ones are Top Cashback and Quidco. Again, I'll send you links to these. But essentially, let's say you're going to buy something that you need anyway. Like we all need car insurance and make sure your car insurance is covered for business cover. Okay, because when you're doing home visits, if you only have a standard policy and you don't have business cover and you have an accident, they won't pay out and you could be prosecuted for driving without insurance. That's valid. Okay, so you need business cover. But let's say I have to get my insurance, right, because I'm going to do visits. I'm going to buy that anyway. If you go to, say, Top Cashback, find the same company you're going to get that from, but click through their link and then get that insurance. You paid the same price you would if you did it directly through, whatever company you get your car insurance from. But like last year, I got £60 cashback on top. All right. I was going to buy that anyway. It took me only 30 seconds extra to click one link. Over things like that. Well, I'm going to go on holiday. I'm going to buy these flights anyway. All right. But I bought it through that link. I got back X amount of money. Do you see? You can just save it up at the end of the year, use it for a little treat. All right. So I'll send you links to all of these things in the post-course reading that will come out to you tomorrow. And then NHS discounts and trainee benefits. If you're not, those of you that are qualified, for example, you're not eligible necessarily for the totem card because you're not trainees anymore, you could still get, as NHS employees, the blue light card that gives some discounts. And then there are some advertised discounts. So places like Apple, Nando's, EE, if you're getting a mobile phone contract, they'll give you a discount, 10, 15% sometimes, just for being an NHS employee. Just show them your, smart card or NHS ID badge. Various restaurants, and sometimes they're not advertised. Just ask. Okay, you've got to have, the willingness to just ask. Do you offer discounts for NHS employees? And often you just show them your badge, and they'll give you a little discount. You don't lose anything if they say no. All right. Journals. If you want to access journals, you can, as an NHS employee, get a free NHS Athens account. Free e-learning and CPD for things like safeguarding, child protection, available on e-learning for healthcare for any NHS employee. And then sometimes, your deanery or your local RCGP faculty might run discounted or even free courses for their trainees only. For example, we run a very popular MRCGP AKT preparation course, and we have some structured programs that include lots of different courses and webinars and online revision. Well, RCGP Beds and Hearts and the Deanery Health Education East of England, they got together and they said, look, your course has had really good feedback from our trainees over the years. We'd like you to run it for our trainees. So we go and run it for their trainees. Trainees in East of England can book the course. It's exactly the same as our course that we run everywhere else that people are paying £250 to attend. And they can attend without paying at all. Why? Because the Deanery and the RCGP directly takes the money from their study budget and pays us. Okay, so you don't have to pay and claim it back even and go through that. Others can pay and then you can claim it back, or you can attend or pay for yourself. But if you're in East of England, there might be other deaneries where they might have a locally run course that you can attend for free. Do you see? So, ask around and find out about these things. Finally, get paid to study. All right. What do I mean by that? Look, if you're in training, you're going to have to do your membership exams one way or another. Right. Now, one of the things, when I was a registrar, I was approached by an online portal, an online journal, if you like, and they said, look, would you write some MRCGP style questions for us with answers and current guidelines and links? We want you to do one article a month with this many questions, and we want you to do it for a year. And I said, okay, well, I'm going to have to prepare for this exam anyway. So if I'm already doing some reading and making some notes, why don't I just write some questions, turn it into an article, and then I'm getting paid to study. All right. And it's actually one of the ways that I got into medical education, is that, getting involved in things like this. So like when you're preparing for your AKT, you couldn't write AKT questions for us because you haven't sat it yet. We need you to have passed that exam. But if you're learning about guidelines for hypertension, what you could do is write an MSRA level clinical question, okay, for our SRA service. We're always recruiting freelance authors from people that, have passed exams well and have interest in medical education, want to get involved. We have some people that write for us once a month, and over a period of a year, they're getting extra £2,000-3,000 income. We have people that write only one batch and never write again. We have some that write one, then they're busy, then 6 months later they write another. So if you're interested, you will be updating yourself on guidelines, making your own notes. It helps you for your thing, but then you can write some questions and turn that into something that will help you fund your exams, for example. Okay, so we pay very good rates, £200 for every set of 20 clinical questions for the SRA, £200 for every 10 SJT questions for the SRA. If you've done your AKT, then £250 for every set of 25 AKT style questions. They need to be original questions. We never accept real questions from the exam. That's unethical and unprofessional. We will tell you what questions to write on which topics. Okay, so just to summarize, look, if you save money, it's much more efficient than earning extra, because when you earn extra, you're first going to pay tax, national insurance and pension on it. So you already lose a third if you're a low rate taxpayer, nearly half if you're a high rate taxpayer by the time you account national insurance, which is about 11%, all of the rest of it. Okay, if you save money, it's actually worth a lot more. So saving £60 for a higher worth rate taxpayer is more than you earning an extra £100. Okay, all of these things I've done, they're minimal investment in time. They're not you working extra shifts. Okay, claim all your allowances and expenses, and then maximize what you already have access to. Your deanery might offer things, discounts or things that are free for their local trainees. If you're already a BMA member, you've got access to the library. Make use of these things rather than spending it for your own pocket. Okay, so that you can spend that on your kids, on going on a nice holiday. Training's hard. You need your breaks. You need your holiday. Okay. So I mentioned I'd give you the link for this. Okay. So it's live.gptraining.info. Here's the code. Okay. Webinar 50, all lowercase, no space, and you put this on the very last payment page. Okay. So on the first page, you'll see the product. Okay. In fact, I'll see if I can just show you. Okay. 1 second. See if I can show you. Right. So you go to live.gptraining.info. Okay. And like the full programs here, what's going to be covered, the speakers, everything's here. But anyway, at any point you click the book now, okay, it'll take you to a payment page. See, one ticket, standard ticket is £195. Extended ticket, which includes a recording of all the sessions, is £245. Put in your email. This is eMedica's email. If anybody wants to contact me, has got any questions, you can use this email. Go to the next page. You fill in your details here. Okay. And then on this page, you just put in the code, webinar 50, press enter, and look, it takes off 50%. That code will expire midnight tomorrow. Okay. After that, it won't work anymore. All right. And you can attend at half price. Okay. So back to here. Any other questions before I let you get away, because it's 9 o'clock now. So I'll take another 10 minutes worth of questions. Okay. So let's go through to questions. Someone's asked, can we claim PLAB 1 or 2 money? No, you can't claim for any courses at all. In terms of exams, the only reason you can claim for MRCGP exams is because it's mandatory to do that exam when you're a trainee. Okay, it's not mandatory to do PLAB. Someone that chose to do that, they chose it because they wanted to come and work in the UK. You see, where someone that's in GP training, it's mandatory to do MRCGP. It's on the list of approved exams, so you couldn't claim for things that aren't on that list. Like, for example, let's say you do an additional diploma. Because that's not mandatory, you couldn't claim the cost of doing that. You might be able to claim the cost of the course from your study budget, but the cost of the exam you pay for yourself. Let's say you do DRCOG or DFSRH or any one of the other many GP relevant diplomas. Okay. Someone's asked, is payment for writing questions taxed? Yes. If you do any extra employment, but also any extra income you get. So let's say you do some cremation forms in hospital and you get a fee, you need to claim that and pay tax on it. So any extra income you need to declare and pay tax on. Okay. Someone says, is there a recording only option for the conference? There will be. There isn't now, but we will be recording every session, process the videos in a couple of weeks, and then it will be possible just to buy the video recording. Okay. Someone else, can a GP become a GP with special interest without doing an MSc? Not necessarily an MSc. For some special interests, you'd need at least that. There might be a diploma and experience that's more relevant. Okay. Someone's asked whom to contact regarding these fellowships. I will send you links to all of the things we've talked about tomorrow. Okay. At the same time that I send you a link to the recording so you can watch this back. If your connection dropped or if some bits were too fast for you to follow and you want to just go over it again, because it's a lot of new stuff we've covered, and then the slides as well I'll send you. And I'll send you links to where the current contract is available and things like that. Okay. Someone's asked, does applying for less than full-time require specific criteria? No, you just apply, but there's no guarantee that they'll be able to give you. Like someone might want 50% less than full-time. They might not be able to match you with someone to cover the other 50%. So they might say, we can give you 80% or 60%. Someone's asked, can we get the recordings of the GP training update with a discount if we can't attend? If you book by tomorrow using the code, book the extended ticket. That includes a recording. And then just tell us, I can't actually attend, I just want the videos. When they're available, we send them to you. Okay. That discount will expire midnight tomorrow. Okay. Someone asked, what if I work in Australia for 2 years after CCT? Do I still have to take the return exam if I want to practice in the UK again? No, there is a portfolio route to the returner scheme, which involves gathering lots of paperwork instead of doing the exams. That's only available for specific countries, but Australia is one of them. Okay. So if you qualified here and worked here after CCT and then went to Australia and you kept up to date and had appraisal there, then you could go through the portfolio route and avoid the exams. But otherwise, generally, it's the exams. So someone said, if I've got MDU indemnity, should I be a BMA member as well? So remember, the BMA does not offer indemnity. The BMA is a trades union, okay? So they will help with things like contracts. The indemnity provider is going to help you with things like GMC investigations, coroner's court inquests, patient complaints, things like that. The BMA won't help with those things. They will help with your contract of employment, not getting the right level of leave, things like that, okay? So is it beneficial? I think as a trainee, it can be quite useful. When you qualify, it depends a lot on your role and how confident you feel in knowing and managing your own contract and whether you feel you need support for that. And someone's asked, is a business and work car insurance the same thing? Yes, so there's 3 levels of car insurance. You can have social, domestic and pleasure only. You can have social, domestic and pleasure with commuting. So that covers you to go to work and back, but not to do visits. And then there's business. Business is generally the top one. You need business, okay? Someone asked, is fellowship count as NHS service? Yes, these fellowship program will count as NHS service. So someone asked, will the code work for the recording only option? Now, there is no recording only option at the moment, but it will work on the extended ticket option, okay? Which then will give you access to the recording afterwards. How do you get a Totem card? Go to the Totem website, select education institution as RCGP. Someone said, if you apply for fellowship, will the deanery give us a random surgery in the same area? The details of things like that aren't there yet. What they've said is that it will be in the same locality, i.e. if you're training in, North London, it's going to be somewhere in North London. It's not suddenly going to be in Scotland, okay? Or it's not suddenly going to be in South London, which might be an hour and a half commute away. But which surgery or how, will it be open competition? Will there be, like what if lots of people want that surgery? How will they do that? They'll probably have traditional interviews like they do now for the other salaried GPs, because ultimately they're going to be paying you their salary. They need to be comfortable that you're someone they want to work with, okay? Someone's asked, can you defer the fellowship? No. Not at the moment and how it's envisaged, okay? But if fellowships are available later, you may still be able to apply for them. What's not going to happen is that it's guaranteed there and they'll hold a job for you for a year or two. There's no mention of that. Just like you couldn't get a salary job now and they'll hold it for you for a year. That doesn't exist, okay? And someone says, if I attended 2 CSA courses, can I claim them both from the study budget? That depends on your deanery. Every deanery sets their own rules. Some won't allow, anything more than one. Some will only allow the one that they run in-house. They won't allow any external ones. Others have an unlimited budget for study as long as you can show it's relevant to your training. Some will allow certain courses that they've pre-approved. Others, like for example, as I said, for health education East of England and RCGP Beds and Hearts, they directly pay for doctors that want to come to the eMedica joint. We run it with the Royal College on their, on behalf of them. In Luton. I'm going to run that in a couple of weeks, okay? So if you're there, it's automatically approved. We have others that have come to some of our structured programs that include more than one course and webinars, and they've been able to claim the whole thing back. Even our AKT Pass Guaranteed program, which includes 9 webinars, 2 full-day courses, 90 days of daily guided reading, 3,000 questions, 4 full mock exams, online revision, case cards. Some people, the deanery has funded all of that. Others, they've funded part of it. They fund the course and the webinars, but not online revision. You just need to contact your deanery and get their details of their study budget and their policy, okay? Someone's asked, how many days is full-time GP? So full-time is considered 9 sessions, which is 4.5 days, okay? So I'm just going to show you, because a few people have asked about videos. If you want to use this code, it's not possible to buy access to the video at the moment, okay? But the whole thing will be recorded. And people that bought an extended ticket, so I'll just take you back here, okay? When you go to book now, see there's 2 tickets. There's the standard ticket, which is £195, or there's the extended ticket, which includes 30 days access to the recording of all the workshops and all of the keynote lectures, okay? And a PDF of the course booklet. So even if you can't attend, if you wanted to pick this one, and then put the code in so you pay half of that, when the recording is available, we'll send it to you. Do you see? Because when the recording is available, it will cost £195. So it's still going to be cheaper, even if you can't attend, but you want the recording. To book this now while you've got the discount, and then get the recording, then to buy the recording separately later. Okay, so that's at live.gptraining.info. Okay, right. I'm just going to see if there's any last questions before I move on. Yeah, so someone just asked, how much would the videos only cost? The videos only would cost £195 when they're available. Okay, great. So looks like the bulk of questions have been answered. If you've asked a question and it hasn't been answered by me live, it's because someone else asked the question and I've answered it already, or it's because it's something that we already covered earlier. And so, you know, you're going to be access to these slides and this video recording tomorrow. You'll be able to watch it back and, you know, go over it again. That's why. But because I can see that we're already late and I don't want to keep you guys any further, it's already 9:13, that I want to allow people to get away now. And last thing, you know, I just want to say thank you very much for giving up part of your evenings. I know, you know, those of you in training, you've got exams, e-portfolio. Those of you out of training, you're even busier. Those of you applying, you know, you've got a lot on your mind. And then, you know, we've all got our things outside of our training and our work. We've got our family and, you know, things like that. So I appreciate you taking up time to, you know, come to something like this. I hope it's been helpful. Okay. Thank you very much. I do hope to see a lot of you at this. It's nearly full now. We've got last few tickets and we're going to be at capacity. But I really do hope that, you know, if you're at any year of training, ST1, ST2, or ST3, you're about to start training. And actually, even if you're qualified and you just want to get access to some of these specialty workshops and the career workshop, and you don't want to come to the AKT or CSA, you know, pick those workshops. I think you'll still find this and all of the keynotes helpful. Okay, so I do hope to see a lot of you there this Saturday. It's at the Holiday Inn London, Brentford Lock, West London, and I hope to see some of you there. Okay, so thank you very much. I hope it's been a useful webinar. If you've got any other questions, feel free to contact me directly through eMedico on Facebook, and I hope to see some of you there. I'll just post the link into the chat for anyone that wants to again get the link. And when you leave, actually, when I shut the webinar, you'll see the link to gptraining.info. Okay, and then the code I've put in there as well. And then anyone that wants to join our Facebook group, GP Training Support, which has got 18,000 doctors in it, I'll put the link to that as well. Okay, please do join there if you're not already a member. 18,000 people who are in GP training or applying or qualified. We've got trainers in there, program directors, really helpful, supportive group of doctors, willing to answer queries. You'll get an answer to your query within half an hour usually. Okay, so thank you very much, everyone. All the best, and I hope to see some of you soon. Okay, thank you.